This is Mediatrix Health Education Digest.
Hi, my name is Dr. Flavia Ogutu. I'm a consultant obstetrician and gynecologist. We'll go on to discuss about prevention. How can we prevent preeclampsia from occurring? One, the one that is given the strongest recommendation and has the highest level of evidence is using low-dose aspirin. So aspirin is actually a medication that we give, and it started at when the woman is less than 12 weeks. So this is the woman you've seen in the clinic. You've identified that she has the risk factors. So we start her off with the low-dose aspirin. And usually in Kenya, we give about 75 milligrams, which is actually one tablet of junior aspirin. And it's given once a day from less than 12 weeks. And the reason we do that is to try to target the time when the placenta is developing. And it's thought to be very protective against developing preeclampsia in such women. And aspirin is safe in pregnancy. There's no risk of fetal or neonatal intracranial bleeding, and there's no difference in development outcomes at 18 months in the studies that have been done. So it's quite safe to use during pregnancy and does not have adverse effects on the mother and on the baby. Another preventative measure that can be used and easy to use is calcium. So it's thought that low dietary calcium is associated with hypertension in the general population, and we tend to be in the low dietary calcium. So WHO recommends that those who are pregnant and lactating should be taking at least 1,000 milligrams of elemental calcium a day, and it's recommended that it can be used in those who are in low population setting to try and prevent preeclampsia. So if a woman comes to you and has a high risk of preeclampsia, so the two ways we would try and prevent is giving them low-dose aspirin when they're less than 12 weeks, which in layman's is about 4 months, and also put them on calcium, which is usually recommended from about 20 weeks of pregnancy. Those are thought to be preventative. Another intervention that is helpful for preventing is weight loss, because we've already said obesity is one of those risk factors, and obesity is something that is a modifiable risk factor. There's something that can be done about weight. So in case you're obese, then losing weight prior to pregnancy is thought to be very important, because it's been seen in studies that if they had a previous history of hypertension or preeclampsia and you lose weight in the time period between one pregnancy and the next, then you have a lower chance of developing it again. As we said earlier, you have an 8 times higher chance of developing hypertension if you've had it before. Okay, so that's a very modifiable risk factor, but that has to be done prior to pregnancy, because in pregnancy we do not advocate for weight loss during pregnancy. We just minimize the amount of weight gain depending on the age, depending on the BMI bracket that you are in. So an obese patient has a lower window in which she can gain weight as opposed to someone who's in the normal age bracket or is in the underweight. Okay. There are so many other measures that are still under investigation, but because they're still under study, we'll just discuss the ones that we've discussed. So in conclusion, regular antenatal care is very mandatory. First, for triaging and seeing which woman is at risk of developing hypertension. And then second is to detect the hypertension or preeclampsia early on. And that would be by measuring her blood pressure. Most antenatal clinics, we do regular urine tests to check if there's any protein in the urine. And for prevention, the ones that have been found to be effective is use of low-dose aspirin less than 12 weeks for those who are at high risk, giving calcium in areas where there is low calcium intake, use of magnesium sulfate for preventing eclampsia, and finally, ensuring that prior to conception, women are in the adequate weight bracket between 18 and 24 in terms of BMI is thought to prevent a lot of these conditions, including hypertension and diabetes. Thank you.
For more information on our services, visit our website or follow us on social media.